My name is Eric Brenner, but I do want to single out Sarah, you're being singled out, for having arranged this, because today is Monday. When did we discuss this? Sunday night?
Yeah.
No.
Yes.
It must have been
Thursday.
Must have been Thursday. I said, is it possible to arrange something? She said, I can do it. And she arranged, thank you so much for having arranged this. At first we thought, gee, let's wait a week so we can get the word out, but next week is what? It's spring break. And besides, some of you may be going overseas on spring break and traveling, which raises numerous issues, which we'll get into. I'd also like to ask, do we have anybody here from the USC Student Health Services? Because at the Russell House meeting today, we had Dr. Judy Santos. You know Judy, who's one of the physicians with Student Health Services, and they've been getting a lot of questions about coronavirus. And Debbie Beck, is that right? Who's kind of is above all Student Health Services. And they were available for questions and answers of an administrative nature after the talk there. So just to be clear, I'm not here to make university policy. I'm not on any USC committee, although they want to make me an honorary member. But USC is handling this coronavirus matter, I think, in a very good way. Have you all seen the website they have? You can just Google coronavirus sc.edu, and they have several pages there. One was just updated today, so it's really terrific. So what I'm here to do actually is not go over the latest about USC policy, which, by the way, could involve some interesting questions. Supposing there are USC faculty and students abroad and about to come back, should they be quarantined? Would they be allowed to come to class? Do you see what I mean? Some of these complex issues. Who would make those decisions? But fortunately, we have someone else in the audience on whom I can call. I wonder if Dr. Gil Potter might be anywhere here. Gil, can you stand up and raise your hand? So, thank you, Gil. Gil is DHEC Medical Director for the Midlands region. How many counties do you have in your region, Gil?
12 counties.
12 counties, totaling what population?
It's about 29% of the state's population.
About a third of 5 million would be, close to 2 million people. So at USC, we're concerned about 35,000 students, but Gil has to worry about 1.5 million people. And a lot of decisions that might have to be made would involve consultation between DHEC and the university. So I'm going to be showing lots of slides. Don't worry, you don't have to read every word in every slide. We're talking a lot about background. The idea is for us to get familiar with something we don't usually talk about, which is coronaviruses. Dr. Chen, do you speak about coronaviruses usually every day?
No.
No? Okay, here's your chance. Okay.
Gary, can I ask
Yes,
a question? Is this being recorded?
it is being recorded.
Okay.
That's right.
Okay, great. Thank you.
So for your friends who couldn't come, they can watch it at home tonight. Very good. So here's a bit of some of the things that we'll be discussing. Much too much to discuss in an hour. I remember, Sarah, back in 2014-15, that wasn't coronavirus, that was Ebola virus. And we were all flipped out about that, and we had a good session about that to help people. Let's see, then in 2016, that wasn't Ebola madness, what was that? Zika madness, we went through it again. So Ebola's gone, well, Ebola's out there somewhere, and Zika, but now it's coronavirus. But that's part of the lesson. We live in a world where we have constantly emerging infectious diseases, so this is a chance to think about one of them, where things stand. So introduction, what's up? I subscribe to the New York Times, and every day there's different articles about coronavirus in it. CDC's website, this is their home page, cdc.gov. You just see the coronavirus there, and you click on it, and you have a link to 500 pages of information. CBS News, coronavirus reaches 12 states. This is already old news. So it's March 1st. That's old news. That was yesterday. And here's the WHO website. where it's interesting, you can get what they call SITREP, situation reports, every single day, an update. This is more of an epi update comes out. I recommend these to those of you who want to follow this from an epi point of view. I like this website a lot. It's one of several which is mapping what's happening with the coronavirus. It looks as if China is pretty much in red there. Bob Chen, I'll give you the slides, you don't have to take a picture, okay? In the Middle East, what's that big circle there? Iran just got affected. It's interesting that several of their high-level government officials now have the virus. And in Western Europe, what's the biggest red circle? Italy, yes, especially part of Italy where we like to go on vacation. When you go to Milano, Caroline, like to go to La Scala to hear the opera and visit the cathedral. You can't go now. Look at this. And look at poor USA, just a couple little red dots here and there, although there have been a couple more just today. Okay? Here's another way of looking at this dashboard. They're talking about 90,000 confirmed cases, 3,000 deaths. What's a bit reassuring to me is this epi curve on the bottom right here, a little confusing, some different colors. There was a big spike on one day, but that had to do with the change of what? Well, yeah, I think what's the case definition? And you could have numerous case definitions. You have to have a confirmatory lab test or not, or just be in contact with a known case, or just be from Wuhan or whatnot. That raises numbers of issues itself. And down on the left side, look at this: China, South Korea, Italy, Iran, others, Japan, and so forth, country by country. Okay. Here's a map. This is a little bit old, a week old. Countries that were affected. If you're a student at the School of Public Health, raise your hand, please. Okay. Do you think this is a good map? This deserves an A or C minus? Pardon me?
C minus.
C minus. Okay. Look at this. Look at this one. Is this better or not? Why is it better?
Specific locations.
Yes, and also the size of the circles is proportional to the number of cases. So I'm a bit surprised that CDC would put out something of this quality. This is a good lesson for the students. How do you communicate complicated things, okay? So this shows the same countries, but we get some perspective about incidents, not just location, okay? Much better now, okay? Oh my goodness, what's the new scientist? Could this new virus kill 50 million people worldwide? It's a good question. Everyone's asking the question. I think probably not. Could it affect 60% of the population, kill 1 in 100, about 50 million people? We'll see. What does Newsweek say? Oh, Trump Jr. says Democrats hope the virus will kill millions. Oh, and that way they can blame Trump before the election. How about that? So this is being, I wouldn't say weaponized, I would say politicized. This is really quite an astonishing time that we live in. And look at this one. What magazine is this? China virus will kill 65 million people. But I'm happy to see they have a sense of proportion that Harry and Meghan get more space than the coronavirus. Nonetheless, these are the kinds of questions which are being asked now around the world, okay? So since we're talking about coronaviruses, let's just have a small amount of coronavirology, okay? Let me ask the students, how many of you have had a course in microbiology or virology? How many have never had such a course? Well, we'll call on you to come up and comment, okay? But, so, first of all, the name coronavirus comes because this virus has, like the corona of the sun, little spikes sticking off it. That's not really fair. A lot of viruses have little spikes sticking off it, right? Most important for us is what's the other main virus we have in the winter with spikes? Influenza with hemagglutinin and neuraminidase spikes. That's why we have H1N1 and H3N2. And hepatitis B has a surface antigen and so forth. Nonetheless, this virus gets its name from the slice of corona that it has, okay? If you go to the CDC webpage under coronavirus, so we have a whole section about common coronaviruses. Most people don't know that, but all of us have had coronaviruses, just different members of the family. And then a couple of special ones: SARS, syndrome of acute respiratory, severe acute respiratory syndrome, back in 2002, 2003. MERS, which stands for what? Middle East Respiratory Syndrome, and now the new one. So it's not as if this is the only coronavirus that we have, okay? You've had virology, you know, we have DNA virus, there's an RNA virus, there's a single-stranded, double-stranded. Anyway, this is the classification. Oh, it's right down there with flaviviruses. Well, what are Zika viruses? That's good. So that's one way to think. This is a distant cousin of Zika virus. If you're an epidemiologist, you know that we like to spread structure the world in terms of what? 2 by 2 tables. So this is my way of structuring virology, DNA, RNA, single, double-stranded. And coronavirus is interesting. It's a cousin. Oh, it's a cousin of Ebola and of polio as well. Very interesting. Okay, I like this because it has pictures. There's corona with the little spikes. At the bottom, second from the left, bottom row, that's filament. That's filovirus. That's the virus that causes Ebola. And next to it, the rabidovirus. For a chocolate bar, what's the terrible disease caused by rabidoviruses? Ah! Maybe, still feel. I mentioned that because here we were worried about our first case of coronavirus, but we did have a case of human rabies in South Carolina in 2011. That had been the first case reported in the States since the late 50s or early 60s. And that was written up in the MMWR. Because what's the case fatality rate for rabies? If you get rabies, what's going to happen? You will die. I shouldn't say 100%, but 99.999999% probable that you will die. Whereas the case fatality rate for this new coronavirus is listed as about 2.3%. I think, in fact, it's much lower. We'll come back to that later on. So it's good to have that perspective, okay? What about common colds? Oh dear. And Carlene, you tell me I'm supposed to cover my nose this way, not this way? No, this way. But anyway, rhino sounds like nose, and there are dozens of rhinoviruses, and most of the colds are caused by rhinoviruses. But look at this, coronaviruses also account for a certain proportion of colds. Notice that influenza is there. Not everybody who has influenza has high fever and myalgias and pneumonia and so forth. You're welcome to take seats in the front. It won't bother anybody. And it'll be useful to think about influenza and coronavirus on the same page as we move along. We'll come back to that. So anyway, coronaviruses by themselves are not new. But let's think about this from the SARS and MERS context. So here's SARS. Here's a student with a red shirt here in the first row. How old were you in 2003?
6.
You were 6? Do you remember following the SARS epidemic? So you should know we've been through this before. That was also the coronavirus that came out of Asia and was spreading around the world and went to Hong Kong and so forth. And you can speed read some of these things. There's a question about who should be notified and when and what should be done. And it's a whole very interesting thing. I like this. This shows workers in Guangzhou in southern China. Well, what are they doing here, these guys? They're scrubbing the streets. Do you think scrubbing the streets is going to be very helpful to prevent spread of a virus which is spread by droplets? Alan Deco? So what's the point of this? It makes a good picture. It shows you that the mayor is doing something to scrub. We're seeing some of this going on now in China also, and elsewhere. Lots of spraying, disinfecting park benches and so forth. That's not what's going to stop the spread of a virus which is spread through respiratory droplets. Okay? This makes more sense. This is infection control, and people at high risk can be healthcare workers, and the nurses and doctors and respiratory therapists who are caring for the patients. Actually, even now with this coronavirus, and certainly in the days of SARS, you have numerous health workers who come down with this, and interrupting that transmission is very important, okay? This is kind of cute here. These are French journalists. They're not even in the same room as a SARS patient, but they're taking lots of precautions to make sure they don't get infected. And even the camera has a mask. How about that? I like this. In the front, on the right, this is Julie Guberding, who was head of CDC at the time. To her right is who? Tony Fauci. And he was there then, and he's still there Now, he's a little bit grayer now than he was then. But Dr. Fauci's been helping us with things going back, certainly going back even to the early 80s when we first got HIV. And on TV in the background, who's that? That's David Heyman, who's then head of infectious diseases for WHO, an old friend and colleague. This was interesting. This was one of the first outbreaks which had global international collaboration. So it's not just between the doctor and the city health department, but this involved also WHO and CDC and the whole world was all of that here. This was interesting. This was a jewelry and watch exhibition in Switzerland, and all the people from Hong Kong and Singapore and China couldn't come because they didn't want what? They didn't want SARS to come in here. This is an early example of something which has not only a health effect, but also what? The economists here, and could epidemics have issues related to economics?
Yes.
Dr. Chen is a health economist, and he knows, okay? I thought this was kind of cute also. Questions often arise as to who should wear a mask and when and so forth. I don't have the whole answer, but I know this is the mask of your cat. I thought this was kind of nice too. This is even the mannequins have their masks on, and this is more epic here. This is from Singapore, which has a terrific public health system. This is their investigation about chains of transmission. For example, look at number 1 there. That's someone who infected what? About half a dozen people. Look up from number 1. That person infected who? Nobody. In fact, all the people on the periphery didn't infect anybody. But look at number 6, number 35, number 130. Do you see what I mean? Some people were very infectious, and other people not infectious at all. So this comes down to some questions then about whether transmission is just a random thing, or there's some people who are, quote, super spreaders. And certainly with SARS, we had a lot of super spreaders there. Okay? Here's another way of looking at this. I made this graph from this previous page here. On the left, it shows 160 patients infected nobody. Everybody see that? And about 20 patients infected one person. But a few outliers, here they are, infected zillions of people. One person infected 40 other people. Everybody see that? Sometimes those were the sickest patients, and also they infected a lot of healthcare workers because they were in the hospital before effective infection control precautions were taken. Therefore, they infected a lot of people. Once better infection control came in, then that was easy to cut down on those. But actually, if you could get rid of the super spreaders, it turned out that there was not enough transmission going on to sustain the infection. And therefore, what happened to SARS by May or June of 2003? It was gone. So this is one of the questions we can ask ourselves also. What we're seeing now is looking pretty bad so far, but this is going to be SARS-like. It's going to kind of stop by the time we get to the summer. What else is common now and is going to stop by summertime? Flu, that's right. So this behave like flu and SARS or not. Though actually many infectious diseases have their own seasonal incidents in any case. Okay? This is also interesting. This is very important. This is called seroepidemiology, looking at prevalence of antibodies in people from different contexts. It turned out that people who worked as animal traders in Guangdong province were more likely to have antibodies against SARS. Let me ask, how many of you have either been to a Publix or a Food Lion or what, Piggly Wiggly? See what I mean? When you go there and buy your chicken and your beef, are the chickens running around there? No. We've been spoiled. We get everything already butchered and packaged and so forth. But did anybody here from China? Yes. Do you sometimes have live animal markets in China where you have the animals there? But can animals have viruses too? They can. So the people who work in the markets can also get infected. That seems to be pretty well understood that that's what happened also with SARS, and likely what's happened in this case also. Okay, this is interesting. This is looking at prevalence of antibodies depending upon what animal is being traded. And the masked people who work with the masked palm civet are more likely to have antibodies. And here's that cute little animal. Isn't he nice? Some of them look more like leopards. combination of beavers, squirrels, and leopards. But the general thought is that the reservoir for coronaviruses is bats, and that bats can infect other animals crossing the species barrier, and people who work closely with these animals, such as those who work in the markets, can then become infected themselves. But then this virus has the ability to be transmitted then person to person. So we may have bat to animal to person to person to person to person. And the question is, how adapted are these viruses then to maintain themselves in human populations? Some do better than others. Okay. Anyway, just look at the x-axis here. You see that by July 1st, there were no more cases, and SARS has petered out. So we will know by June, by the end of this, by graduation, we should know what's going to happen to this virus. Okay. Okay. Oh, look at this. So just as we have coronavirus in the news now, look at this, the truth about SARS. I like this. I think that's Saddam Hussein in the upper right-hand corner. Saddam Hussein is not as important as the SARS virus. Look at that. SARS nation. Okay. Okay, how about MERS, the other coronavirus? It spread from the Middle East to the USA. So here you can read about it. Where have cases been seen? Now, unlike SARS, which went away by the end of 2003, MERS has kept itself going, but not in large numbers. We've had cases mostly in the Middle East, centered around Saudi Arabia. But look at this, all over the world, a few cases, even a few cases in the USA. How could someone in the USA get MERS? Probably traveled to where? Saudi Arabia. So look at patient 1, tested positive, well, bats is the reservoir. We have patient 1 tested positive for MERS, traveled from Riyadh to London to Chicago to Indiana. Are people allowed to travel around the world that way? Dear, dear, dear. And patient number 2 traveled from Saudi Arabia to London to Boston to Atlanta. How could you get MERS in Orlando? You don't have Middle Eastern bats and camels there. Maybe at the zoo. This is really quite an amazing story. Okay. MERS, okay. This takes us back to Ebola, and I put this here. This is an infographic which we used back in 2014-15, where the reservoir for Ebola is felt to be bats. Although I don't think the virus has actually been, where's Sean Norman? I don't think the virus has actually been isolated from bats. But recently, the Marburg virus, which is a related filovirus, has been isolated finally from bats. But the idea is it's probably been transmission from bats to other game animals, primates and others, which are then hunted. And when someone is, maybe a hunter, is cutting up the carcass, they become infected, and then you can go from person to person to person. So again, we have bat to animal to man. Very interesting. Okay. Next point is the general context of emerging infectious diseases. Okay, let's talk about this. Here are just a few examples of emerging infectious diseases. Ebola has probably been around for a long time, but we didn't know about it prior to 1976. HIV. How old were you in 1981, please?
Wasn't born yet.
No? Don't you remember the emergence of HIV? People nowadays think, Lil, can you remember pre-HIV days?
Yes.
Yes?
Yes.
So that was our coronavirus, so that period actually much worse. This has gone on to infect millions of people. And nowadays people don't think twice about it. West Nile virus, this is so interesting. The Nile is in Africa, right? Flows up from Central Africa, up through Egypt, up to the Mediterranean. If you go to Uganda, west of the Nile is the West Nile district. That virus was found there decades ago. So this wasn't a new virus. It had been described before, but what was new is it was seen where? Anybody remember? In Queens, New York. Not far from LaGuardia Airport. I remember that the first outbreak, 7 or 8 people had viral encephalitis. So what is this strange virus? It turned out to be the West Nile virus. And guess what happened to that virus after that first introduction to New York? It went coast to coast, and by about 2004, 2005, the West Nile virus all across the country. So it shows that when something is introduced from another country, it can go coast to coast. SARS we discussed, Ebola we discussed. Zika, where is Zika now? I mean, that's what we heard about back in 2016. There are some recent articles about that, and now, of course, COVID-19. Okay. My friend Robert Ball, Lillian Robert Ball, yes, so his definition of emerging viruses, emerging diseases, it's either new diseases that we didn't know about before, or they're old diseases, but they're up to new tricks, such as appearing in the place where they weren't before, or getting resistant to drugs, or susceptible. Something new is going on. And if you're interested in emerging infectious diseases, there's a big literature about it. I like this graph a lot. Look at all these names of all these diseases here. In the US, on the left, I see human monkeypox, anthrax, bioterrorism. At the bottom, dengue, yellow fever, cholera, Ebola, plague. Everybody with me? So there's always something new popping up somewhere in the world, and sometimes it gets squashed, and sometimes that comes back again. I like this a lot. The challenge of emerging and re-emerging infectious diseases. Look who the author is again. Tony Fauci. He's been doing this for a long time. Okay. If you go to cdc.gov/EID, the CDC actually has a free online journal called Emerging Infectious Diseases. We've just stopped the print edition. I've collected every issue since volume 1, number 1. Currently at the bottom of our closet, you know what I mean? That big stack there. It's very valuable now. But anyway, all the articles are available as PDF. And now it's just available online. Look at some of these. Look at 1, 2, 3, fourth one down. The role of live duck. This isn't bats. Live duck movement networks and transmission of avian influenza in France. How about that for emerging infectious diseases? And something, drug-resistant TB from a clade identified in Beijing is not causing cases in the Ukraine. Very interesting. Everybody with me? There's always something going on somewhere in the world. So highly recommended emerging infectious diseases. Okay? Now, aside from CDC journals, we also have different ways of looking at things. So here, since, how many from China in the audience here? Raise your hands so we can see. about 4 or 5 people. Anyway, everybody knows where it's China. How many are not Chinese but have been to China? Oh, wow, that's quite a few. That's great. So here's China, okay. And here we have all the provinces. Here's Beijing up there, and Shanghai there, and Hong Kong down here. Actually, those are the main cities which a lot of us know about. But here we're concerned more with here Hubei province, and that's where the epicenter has been for this particular outbreak. It's so interesting to look at the geography here, because this is the Yangtze River, which flows across the southern part of the province. And then here we have the Han River, and Wuhan is where the two rivers come together. Look at in St. Louis, isn't that where Missouri, Mississippi come together? Something like that. Okay. So there's Wuhan. And look at this, a beautiful city. The two rivers coming together. Look at the size of those skyscrapers there. So New York has about 8 million people, but Wuhan has about 11 million. Is that right? It's really a very big city. Have you been there? No? You need to go visit. Okay. This is so interesting. Once the government found out that there was ongoing transmission there, the city was essentially shut down. And people could not enter or leave the province, did not leave the city, and other cities were closed down. And actually, that's right, so the city was in quarantine, but also the province was quarantined, but actually people were also in quarantine. It leads us to the question of quarantine. That sounds like the Italian 40, or the French 40, right? Means 40. And why do we have that word? Because in the old days, I think going back to the Middle Ages, when there was Black Death and bubonic plague in the world, ships coming into the harbor in Venice said, don't get off the ship yet. Stay out in the harbor for 40 days. And then if no one is sick, we'll let you on shore. It sounds a bit like what they're doing now, you know, people coming in from China. We're not doing 40 days, we're doing 12 days. Why 12 days though?
Incubation.
Yeah, incubation period, although you might, yeah, what's the incubation period of this disease? It's not totally well studied. We're seeing, you know, maybe 2 to 12 days, something like that. Sometimes to be safe, people say, let's wait 2 incubation periods. That's what they were doing with the Diamond Princess, you know, that ship that was in the port of Yokohama near Tokyo. Let's all stay put until there are no cases for 14 days. But then there was ongoing transmission on the ship. But people were supposed to stay in their cabin. How could that be? How could that be? We're in a big auditorium. How can we breathe here? Where's the air coming from? Where's the air going? Do you see any vents anywhere?
It's right there.
Above my head? Yes. Now, is the air coming in or is it going out? I'm not sure. People were so interested in the transmission on the ship. But if you're interested in infectious diseases, there are often outbreaks on ships. We've had norovirus, for example. What else have we had? Legionnaires' disease on ships, foodborne outbreaks for sure. I've worked a lot with tuberculosis, and there have been numerous instances of TB transmission on ships. The most famous is the bird study. I think there was someone in the torpedo room in the front who had TB, and the cooks in the kitchen in the back of the ship got TB, but they were never in contact. How did the bacillus go from the front of the ship to the back of the ship? Ventilation. So I've been here, I'm waiting to see the good environmental health review of what happened on the Diamond Princess there. Anyway, if you look at that main street on the left hand, you see lots of traffic there, and on the right, all stopped. So the city came to a stop. Did that stop the virus from spreading around the world? It didn't. But what it did, in a way, it gave the rest of China a little extra time. It gave the world some extra time. So you lose something in terms of economic activity and whatnot, but you gain some time for people to study this and get prepared and whatnot. Here we are. This is at the train station in Wuhan. We're doing some spraying on the floors. I'm not sure it's going to help that much, but there can be virus on surfaces for sure. Here's downtown Wuhan. Nobody's out and about. This was really amazing. Chinese friends, did you see this slide here? They said they're going to build a huge hospital in just 2 weeks. This is January 24th. Look at the skyscrapers in the background and how many bulldozers do we have here? About 50 bulldozers. January 24th. By February 2nd, look at this. Is this amazing? The skyscrapers are still there, but there's a new hospital here. This meant that you'd be able to put people in this hospital and not risk transmission to other people through air vents or through face-to-face. Very interesting. Okay, there compared to 2 days. Okay. The Tuesday Times has a science section. My wife usually says, "Oh, do you want a science section?" And then we usually look at that. I was surprised. This is February 4th. This is a month ago. The whole first page, the whole front of the Science Times is about the new virus. Who else is a student besides this student here? Yes, okay. Yes. Who is this on the left here? Who's head of public health on planet Earth? Dr. Tedros, the Director General of the World Health Organization. He's playing a key role here right now. Just as Fauci's head of NIH, and we have Redfield, head of CDC, so this is now the head of public health for the planet Earth. Are there any people who are not on planet Earth? They could be up in space, right? We do have some people in orbit, so we hope they weren't incubating coronavirus before they went up into orbit. Otherwise, we will have to send you up there to help these out. Oh my goodness. Not only can it be an epidemic of viruses, an epidemic of, look at this, an infodemic. I hadn't that word before. False information. But we hear a lot about this nowadays in different ways. We hear, people saying, "Oh, the virus was made by Americans to help stop out the Chinese economy." Oh no, the virus was made by Chinese to spread to the West. Have you heard these kinds of things before? And many other kinds of things. So it's all nonsense, of course, but interesting to see the WHO contact. Let me see, I have my iPhone here. Oh, I'm worried. Apple's financial forecast. A lot of the parts for your iPads and your iPhones and your Macintoshes are made where? In China. And if you cut off trade, what's going to happen there? You know, the economic consequences. Again, those markets, the stock market's going down, so forth and so on. Here we have Milan. Italy's economic engine sputters. I've lived a lot in Switzerland, and Switzerland just had its first case last week in the southern part of Switzerland, which is adjacent to northern Italy, and there was someone who had traveled to Italy, came back, and now they have 24 cases there as well. Okay. Oh my goodness, White House indicates emergency funds. Okay. This is a bit complicated because I don't know all the Dr. Chen, you're an economist. Have you read the president's budget proposals for next fiscal year? There are some cuts proposed for CDC, for example. Sounds bad, but maybe the CDC cuts won't be for infectious disease, we hope not. Maybe some extra funds coming now for coronavirus. Some of those funds are actually being taken from what had been an Ebola fund that President Obama had put aside in 2014, 2015. That was being used for something called global health security. That may be taken from there and not put to this fight here. This is along the Amur River between Russia and China. This is a bit interesting. There's a Russian city on one side, and the Chinese on the other, and can the virus cross the river? So you can see. Do we have that problem in Colombia? Do we have the river? Can the virus get from West Colombia or Casey over here to Colombia? But you can see how these could be issues here. WHO says the world's not ready, all kinds of things. Aha. How does the virus get around the world? So let me stop a second with those dots and see if we can see a special video here. What? What? Recommended? Here we go. Okay, each dot is an air flight tool. This is showing 24 hours. Right now, Siberia and Russia are in daylight. Now morning is starting to come to Western Europe. Look at that. You see flights crossing from the USA to Europe, night flights there. It's getting to be dark in the USA, so the number of flights is going down. Everybody see that? Each of those dots is an airplane with several hundred people on it. You think viruses can go around the world easily? Look at this. But now look at Europe. It's full of flights going every which way. Now the US is morning on the East Coast, flights coming up. It's still dark and early in the morning out in California. There we go. So you kind of see that's getting to be dark. Now flights going down in China. This is very valuable perspective because we say, gee, how can we have emerging infectious diseases? It's because we've created a world where viruses can go around. Are viruses allowed in airplanes? No. Any of you who work with malaria might know that sometimes when planes land in certain places, coming in from places where malaria is common, some people come on board and spray the plane with anti-mosquito agents to keep them from popping out. There's a certain kind of malaria called airport malaria, where baggage workers and ground crew, you know, in France or Switzerland or Denmark, who've never been to a tropical country, get malaria. Because where? Because why? They work at the airport, and the mosquitoes have come on the plane and pop out and bite them, and they get malaria. Very interesting. Okay. Back to this here. Okay. Now this is also interesting. So we've seen economic impact, now we also have political issues, hence to lead the US fight against coronavirus. We'll come back to the picture about that in the middle. This was interesting. This was last week. We had been hearing before. We used to say, well, it might come here, but now we say it's not a matter of if, it's a matter of what? When. And has it happened? It has happened. We've had several dozen cases here in the US. Okay. Unlike this, at least the candidates get the big part of the front page, but on the right it says, could be bad, viral crisis you got to deem likely, right next to the presidential candidates. I'm not sure that there's enough discussion about public health, although they do speak about healthcare, but how about disease control? We'll have to write them a note about that. Okay, parents, we've seen this. Oh, this is interesting. This is not from the Science Times, this is from the business section. It says, companies scramble to devise policies for working from home. By the way, could that become an issue here at USC? Supposing you had a big outbreak of respiratory heart disease and you had 20 students in the hospital and 3 students died, could there be some question about whether or not classes should be what? Canceled, and have distance learning and study from home? Is your department prepared to do this? Is the School of Public Health prepared to do this? Okay. But aren't you the associate dean? But there are people on campus who are looking at this now, and there's a committee, and there will be guidance. And Gil Potter, has DHEC been discussing these kinds of things about eventual, for example, even high schools or other school shutdowns? Have you been discussing that?
We have not been discussing it actively yet. I'm sure that will come up. I'm sure there will be questions to us about it.
Lots of questions coming up, that's right. And if the Clemson should shut down for 2 weeks, then people say, well, how come they're shutting down and you're not? You see what I mean? But we have at USC here a very good kind of emergency preparedness committee. They are working on those things, and they are following what CDC says, they're following developments in epidemiology, and they're in touch with DHEC. So this will all work out if it needs to be. At the end, I'll explain why I think we're not going to get that far. Okay. Stocks to die, we've seen this, okay. This is interesting. Most cases of the illness are mild. Now this is a little strange. Oh, is this bad or is this good? It's good. Because the press talks a lot about deaths. They're looking at something called what? The case fatality rate. The numerator would be what? Number of cases. The denominator would be what? The numerator is numbers of cases who die, deaths, divided by the number of cases. But a lot of cases are so mild they've never been reported as cases. So when you say, gee, we've had 2 cases out of 100 have died, the case fatality rate is 2%, but maybe there have been more than 100 cases. A lot of cases are mild and never sought medical care or were asymptomatic. So maybe the denominator is not what? 100, maybe it's 200, in which case the case fatality rate would be what? 1%. Or maybe the number of cases is 400, in which case the case fatality rate is less. Do you see what I mean? So it sounds upsetting to think, oh my goodness, there are cases out there that we don't know about. But the good thing about that could be that the actual case fatality rate is less than what we think. Furthermore, people who have mild cases and recovered are likely to have what? Antibodies against the virus. Therefore, they will be protected against what? Subsequent infection. Therefore, in the future, the virus could have more difficulty in spreading around. You see what I mean? So on the one hand, you say, oh, I hope there aren't more cases out there. On the other hand, you might say, gee, I hope there are a lot of mild cases out there, because that means diminished transmission in the long run, the case fatality rate will be less than what we think. Okay? This has also been unfair. The New York Times is jumping all over CDC about testing the women in Northern California. Maybe you've been following this. At first, just CDC had this new virus, so there was a new test, and CDC could do it. Then they sent test kits out to the states. Gil, is that right, that our lab is supposed to have a testing capability?
We have that capability now.
But the first batch of tests couldn't work, but it got back to CDC, and now there's a new batch out. But CDC could only do 500 tests a day. They had to set priorities. So priorities could be, well, we'll just come back from Wuhan or Korea, you see what I mean? We've been in contact with the case, and we'll test you, but they just can't test everybody in the country who has a cough and fever. Most of that is what? Flu. So they were doing the logical thing, yet one of the people who was sick did have this particular virus, not being criticized. Not really fair. Okay. This is more worrisome. U.S. said to put ill-trained staff at risk of virus. When Americans came back, also U.S. consulate people from Wuhan and students and whatnot, and people from the Diamond Princess came back to the US. Special planes came and took them to different Air Force bases, and they were put in quarantine there. But the people who were going to interview them and take care of them should have been what? Well-trained in infection control, and they weren't. Does that sound like a potential problem? It does. That sounds like a little failure of communication. What we need to do to help coordinate this. Don't you think? Okay. Trump versus column. This is interesting. So look at this. So here we have the president and the vice president, but here's Tony Fauci, a little grayer than before, back in the SARS day, head of National Institutes of Allergy and Infectious Diseases, and there's Dr. Redfield, CDC director. The question is, do they get to speak up or not? There's been some controversy about this. I think we'll have a chance to speak, but in a way it makes sense to have all the agencies have a common spokesman. This will be under Dr. Pence, under Governor Pence. But then he appointed somebody else to be kind of his lead for that. Military is planning, blah, blah, blah. This is not from 2020. This is from what year? 1918. This is pandemic flu. That was really a pandemic, okay? And this is interesting. This says to take on the coronavirus, go medieval. That's to enforce quarantine, as we're doing now. Global pandemic warnings. Okay, let's skip all this here. Okay, enough about this. How about something pleasant you can all enjoy, such as sports? Anybody here basketball fan? Who's you going to see playing next? Kentucky? Pardon me?
Well, the women play in the SEC tournament.
The SEC tournament, okay. Well, could sports be affected by coronavirus? Okay, look at this. The Tokyo Marathon is supposed to have 38,000 runners. They said, no, we only want the top 300 runners or so. The rest keep out because we have coronavirus here. So look at that. And then what's going to happen, what's scheduled to happen in Tokyo this summer? The Olympic Games. Might the Olympic Games be canceled just because of coronavirus? Look at this. So lots of discussion about this already. You have to make a point, just make a decision at some point. This isn't just closing down USC, this is closing down the whole Olympic Games, okay? But that raises issues about, we saw the airplanes flying from place to place. That has to do with transportation issues. But how about places where you have what they call mass gatherings, where you have not just 10,000, but tens of thousands or 100,000 people or more all coming together in all countries of the world, okay? So let's look at this here, about the Summer Olympics there. Can you think back to 2016? People said, oh my goodness, they should cancel the Olympics because Brazil has been having what? Zika. We don't want 100,000 people going there from all countries in the world, getting bitten by Aedes aegypti and then taking the virus back to their house. But I wasn't worried because the Olympics were in what month? August. August here is summer, but in Brazil, August is what? Winter. That's not hot. That's not peak mosquito transmission season. So when you do public health, you've got to think about the northern hemisphere and the southern hemisphere as well. Okay. The pilgrimage to the Hajj in Mecca, and they've had numbers of issues there. Let me show you some pictures. This is pilgrimage to Mecca, where people come to Saudi Arabia from all over the world. How many people are there and from how many countries? It's all coming together, and if there's something infectious, they could do what? Catch it and take it back to their country. Has ever happened in the past, numbers of times. And this is the Olympic Games in London, people from all over the world. So if some of you students are looking for a term paper to write, I would try this. Effect of mass gatherings on international spread of infectious diseases. You recommend that to your teacher paper. How about this as a mass gathering? When is graduation scheduled to be, in May? Oh my goodness, we'll have parents coming in from all around South Carolina and neighboring states. Supposing we're in the middle of an epidemic, might you have to cancel graduation? Send people their diplomas by email, right? Or something like that. So just some things to think about, okay? I will mention one thing about the Hajj. The early 70s were the last couple of years of work to eradicate smallpox from planet Earth. And in 1972, smallpox was only gone from North America and South America and Western Europe. Then came the Hajj, and you had pilgrims coming from Middle East and India and Bangladesh and Pakistan, and some of them had what disease? Smallpox. Spread to other people, then went back to their country. Therefore, smallpox was reintroduced to Europe in what's now called Kosovo. It's, in effect, had to be eliminated again. That again shows the importance of these mass movements here. Okay. Something simple here with infectious diseases. We think about reservoir, where the organisms live, and susceptible hosts. If we were all immune to everything, we wouldn't be susceptible. There'd be no infectious disease. And what's the mode of transmission from the reservoir to the susceptible host? And my friend here, what year are you in?
Senior,
You're a senior undergraduate? What would you be doing next year?
grad school for speech pathology.
Speech pathology, you need to go into infectious disease epi. So reservoirs, so we have animal reservoirs like rabies, environmental like tetanus, but also some bugs have human reservoirs, okay? And different modes of transmission, so we have here droplet spread and airborne spread. Since people have Zika on their minds, one question arose, could this coronavirus be transmitted from by pregnant women from mommy to baby? It's already been studied and so far looks good. And I wouldn't expect something bad to be here also. Okay? We've been talking about coronavirus and influenza. So lots of articles about this already, comparing the two. I think this is an important slide. This is, through February 22nd, this is already 10 days old. We estimate already 30 to 40 million cases of flu per year, this year. Well, how many cases of coronavirus do we have? 30 or 40, and this is 30 to 40 million. Does that provide some perspective? Okay. Is the press talking night and day about influenza? Not at all. Millions of medical visits, hundreds of thousands of hospitalizations, and several tens of thousands of deaths. So it's important to keep these perspectives in mind, although the counter-argument might be yes, but just to wait and see, may get this far also with coronavirus. I think not, but this is useful perspective here. And this is what we were talking about before. We have the deaths come from hospital cases and total illnesses. The total number of infected people, I think, is larger than has been tested. Okay, vaccine efficacy. Let me ask in this room, how many of you have had your flu shot Twitter? How many really, close your eyes, don't have to say, how many of you have not had the flu shot Twitter? Small number, okay. I get the question asked every year, and people say, well, I hear the flu vaccine is not very effective. It's not very effective. You can study calculate vaccine efficacy. It's one minus the relative risk. But anyway, there are 2 new Ebola vaccines out there. They're not 100% effective. Let's say they were. What would save more lives? Vaccinating everybody in the USA with a 100% effective Ebola vaccine, or vaccinating everybody with a 50% effective flu vaccine? Flu. If the vaccine is 100% effective, but there's no disease around, then what's the cost benefit from that? A lot of cost, but no benefit. Thank heavens for the economists here. Okay. But if we have tens of thousands of deaths, and you can prevent even half of them, that would be a lot. Not only are you preventing deaths and so forth, the people you're protecting will not be passing the virus on to their family members and their grandpa and so forth. So that's another way to look at that. Okay. Okay. Let's take a quick look back. Here's influenza pandemic of 1918. Look at that. Crude death rate for infectious diseases in the USA. Mind-boggling. Okay. This we saw before. This was a military hospital ward. We see masks being worn on cats and mannequins and people in China. In the US, people were wearing masks in 1918. This is the police department, I think, in Philadelphia. And the churches were closed. Sounds like Wuhan. By the way, we saw that a lot of the transmission in Korea was due to what? A particular sect of the church, lots of transmission. And these are ladies having a church service outside all wearing their masks, okay? And in 2018, let's see, we had about 6,000 deaths from influenza in South Carolina. If this happened again, we'd have 15,000 deaths, okay? This, I think, would be key and something I'd love to discuss with the class sometime. This is 2017, community mitigation guidelines to prevent pandemic flu. This is in case there's no vaccine, no antiviral, what can you do? It looks like covering your cough. It looks like washing your child's hands and your hands, maybe avoiding mass gatherings, okay? And I like this a lot. Maybe this will be the last slide that we'll show here. They're showing in purple here a pandemic outbreak if you have no intervention. So think of it this way. The area under the curve would be what? Number of cases. And the width of the curve would be how long the outbreak lasts. And the height of the curve would be how many people are sick at one time might all need to be hospitalized. So even if you can just do community mitigation, such as avoiding mass gatherings, canceling graduation, closing classes, heaven forbid. What that could do, you can't solve the whole thing, but you could lower the area under the curve, fewer cases, push it to the right, have more time to prepare, and avoid the big peak so that Palmetto Richmond and Baptist and Providence hospitals don't get swamped. Because even as we're talking here, they are talking right now about what they're going to do if they have many, many cases. So we'd have to stop here and just move down to some mini summary here. No. Forecasts. What's going to happen next? Scenario 1. This dies down by the summer, as SARS did. Or maybe just quiets down, and then picks up again in the fall and winter, like flu. Anybody know this for sure? Nobody knows. Okay. Or it becomes established, something like measles, and becomes infections, comes around yearly, and we'll just have this for a while until we get a vaccine, which should be a year or two. Or something else. Would you care to vote on this? We don't know yet. Okay. So what now? I think it's good that at the state level, the governor's calling a task force together this week, faster. Where can you go? The DHEC website's very important. Look at the, down below, it says most popular search is coronavirus disease, and they have here lots of information and lots of links. Look at this for travelers, educational materials, news releases, well done. And they even have different infographics if you want to give people basic information. Go there, okay? USC's page, and I congratulate the USC Student Health Center and Emergency Group. They have a very nice website here. This is updated February 28th, but actually it's been updated today, and they have lots of information there. So we could go on for quite a while, but that's about an hour. I'm going to stop here, and to those who have to go, please feel free to go, but maybe just wait for one or two, for first of all, a comment from Gil Potter from DHEC maybe, and any other questions you might have for Gil or for myself. Gil, would you care to stand up and tell us what you guys are doing at this level?
Well, I'd just let everybody know that before coronavirus came along, we had jobs and fully employed. After coronavirus came along, we still had jobs and fully employed. And now, additionally, everybody wants us to come and talk to them about coronavirus. So if you get up, so I encourage everybody to use those websites instead of pulling us away from triaging calls from clinicians and individuals so that we can work on those things. Just thank you, please. We are working now under a new set of criteria for testing. CDC published new criteria on last Thursday evening, and it certainly more restrictive on who we can test, because it looks as though they're looking for severe cases of hospitalizations now, instead of a traveler coming back with signs and symptoms, coming to leave, 2 days ago, and now they have signs and symptoms, but they're not sick enough to go to the hospital, our criteria don't fit for that. And, it's not the first time I've disagreed with CDC, but they got some good brains down there, and I hope that they thought this through, why they need to be doing this, and I trust that they are. It may be because we're not going to have enough tests to test all of those kinds of cases that I just mentioned. And we're going to be working with those that are more severe disease. Once again, there's tremendous information assets online. University of South Carolina Student Services has a great one. DHEC does, CDC does. So there's a lot of information sources that people can turn to, and the internet's fairly ubiquitous everywhere, so we can access those sources. We ask you to do that as much as possible.
Good, thank you, George. All right, well, thank you so much for coming. It's been much unusual. We'll be following this as it develops, and maybe, Sarah, maybe next month we'll need to do it again as things evolve. Thank you very much.